I first learned about the magic and power of the High Fidelity Wraparound through our first grant with the City of Richmond and our regional grant. We had approached UMFS to go after that grant, and it was such an exciting experience. But when I heard the first family expressing what their experience was, how they had struggled for years with mental health issues and relationship issues, and this mother and daughter came together and learned how to totally transform their lives. It was so exciting that it became my mission to champion it. So when I came to Virginia Beach, there was no high fidelity wraparound, and I said, we're going to repeat this. So second grant came out, and I immediately went to UMFS and said, we've got to do this again. So we brought 6 localities together, 3 private providers together. We built the whole capacity up. It was just amazing.
With being the CSA coordinator with the City of Chesapeake, I get the privilege of sitting on the Regional Steering Committee for the Systems of Care grant. This has allowed our locality to become educated about the high fidelity wraparound model, intensive care coordination services, along with the other branches inclusive of family support partner and peer support. This has in turn allowed our families and youth to participate in this service, which in turn decreases the number of children going into more restrictive placements, such as congregate care, which is inclusive of group homes or residential facilities.
This model is probably the only model that truly reflects what CSA is all about. Children's Services Act is supposed to be strengthening families, it's supposed to be empowering them, it's supposed to be helping them build their vision, and it does it just beautifully. We recently had a family who didn't want to participate in it and didn't want anybody in their home, and they have started it, and it's transformed their whole attitude. So over and over we see this. Through this second grant in the partnership, we became introduced to the open table model, and that became my second mission. Through the open table mirrors the same philosophy, the theory of change, that high fidelity wraparound does. But what it does is it incorporates the model for the people in the community, for churches, for civic groups, whoever wants to help others. And it really helps for anybody who has relationship poverty or economic poverty, and it helps sustain the gains that families get from high fidelity wraparound.
Our locality has established our own Systems of Care Committee, which we call our local Systems of Care, which branches from the Regional Steering Committee. The main focus is sustainability, in addition to looking at systems of care collectively. So we're looking at how our families are affected by the court system, how they're affected by foster care and the social services, so on and so forth, and how we can collectively benefit our families, as well as maintain use of the high fidelity wraparound services. And so our committee is made up of the same stakeholders that are usually on our FAP teams, which are inclusive of Department of Social Services, court services, public schools. We also have community programs, which is a branch of the Department of Social Services as well. But again, looking at different facets of our community, looking at our religious community and how we can involve public businesses as well, again, to support our families.